Hey, what's up, guys? This is Ryan, and today is exactly the 5-month mark after having surgery to repair my ruptured patellar tendon. Bringing out another update video. This one's going to be a little different than some of my other videos where I typically show exercises that I'm doing, range of motion stuff to try to improve the strength and function of my knee. This one, I'm just going to talk about the actual state of my knee as it stands right now at 5 months. I feel like a lot of the people who are watching these videos are not quite as far along as I am. Typically, they're in the first few weeks because guys are trying to figure out, what they can expect. And so, I think this might go a long way to help some of those guys out. And then there's some other guys I think that are watching them that are roughly the same time frame as me, and so we can always compare and contrast, certain issues and progress as well. Definitely leave a comment if I mention anything that you're either having or had. If you got a question, I'll do my best to answer questions. And so here we go. Let me tell you about how my knee's doing. All right. So as you can see, it doesn't quite look like my other knee yet, but a lot of the swelling has gone down. You can see some of this definition in here has come back, I would say really within about the last few weeks to a month. Even out here on the outside of my knee, I've still got a little swelling in here. I do still have some numbness right all along the skin up in here. I think that's pretty normal. I've heard that from quite a few people, so I don't think that's abnormal. I don't know if you can tell in this position, you can see that my quads are coming back some. I don't think it shows up on video, but there's still a pretty massive disparity. If I'm standing in the shower or something looking down at my legs, it's really obvious the volume on my one good leg versus my injured leg. My calf in my injured leg actually really didn't suffer any loss size-wise, and I don't know if that's just because you're using it even when you've got your leg, the brace locked out. I don't know if you'll be able to see it on video, but I've got this lump that's sort of developed back here, almost like a baker's cyst. But if I lay down and put my leg up in the air, all that fluid will drain out of there, so it's not actually a baker's cyst. And I've noticed that, if I don't have any swelling going on, I've not been working out, I don't really have any issues with that. Range of motion wise, at 5 months, I'm essentially 100% range of motion. If we're splitting hairs, I'm not quite there, but I don't have any limitations in that area. In fact, day-to-day activity, I essentially don't have any limitations. I can walk up and down stairs. I can do work around the house. I can, I go to work. There's not really any issues in what I would consider normal day-to-day activities. Where I've not gotten to yet is in activities that I like to participate in, sporting activities, whether that's basketball or I really like to surf. Some of you guys might like to play soccer or football or rugby or any of those things. I'm nowhere near where I would need to be in order to do those. So, if you've been watching my other videos, a lot of times you'll see me doing activities in those videos that they make me look quite capable. Maybe that's some jumping, running on a treadmill or anything like that. But those activities are really, really controlled activities. They're not complex. In a sport where you don't get to control the environment, you might be running in one direction. You go to plant your foot and cut. You've got all your weight on one foot, and then someone hits you. And now there's so many variables in that I just am nowhere near what it would take to operate on that level. The disparity in strength between my good leg and my injured leg is quite huge. I'll try to put up a video here that'll kind of illustrate it. But I'm making progress in that area. I'm just nowhere near there. So day-to-day activities, almost not even noticeable. I'm completely recovered to that point. How long it's going to take to get to whether I could go out and play a sport, I honestly don't know. I'd like to think that I've come a long way in 5 months, and so maybe only in a few more months I'm there. But I just don't want you to see the videos of me doing these activities and think, oh wow, man, he's so far along. But I'm really not. I've recovered to just normal functioning day to day. Going out and doing sports is a totally different story. And so, I don't know where you guys are at. I'd love to see some comments. Hit the like button, subscribe. I'm going to keep putting out videos, and thanks for watching.